This video will review a lumbar manipulation technique in a side lying position. We will demonstrate the technique all the way through, then break it down step by step. Begin with your patient in side lying. Ask the patient to come towards the edge of the table towards you. Adjust the table so your ASIS is level with the patient's upper ASIS. Flex or extend the lumbar spine to the desired level by moving the patient's lower extremities with your caudal arm. Ask the patient to straighten their bottom leg while maintaining flexion of the upper leg and placing the foot of the upper leg in the contralateral popliteal fossa. Ensure that the knee of the upper leg is not in contact with the table. Rotate the patient's trunk by pulling the patient's lower arm and shoulder anteriorly until end range rotation is reached. Ask your patient to grab their wrist with their opposite hand, then log roll the patient towards you. Place your upper arm under the patient's arm and onto the posterior lateral aspect of their rib cage. Your caudal arm is placed in the space between the patient's iliac crest and greater trochanter. You can then palpate the desired segment with both hands. Continue to apply a rotational force through your arms, pulling anteriorly with your upper arm and posteriorly with your lower arm to take up the slack. You can take up additional slack by shifting your body weight to emphasize the desired segment. Provide a high-velocity, low-amplitude thrust downward towards the table. There are many modifications for this technique to make it more suitable for your patient's body type or your body type. You may place the patient in generalized flexion or extension for a non-specific manipulation, or flex or extend to the desired segment for a more specific manipulation. If you wish to open or flex the desired facet joint, have the patient lay on the contralateral side. If a closing or extension manipulation is desired, have the patient lay on the ipsilateral side. As an alternate hand placement for the patient, you can have him or her stabilize their lower arm with their hand behind their head and upper arm resting on their side. Now we will put the steps together and show you the technique all the way through.